Okay, I'm going to tell you the story of Ricky Abernathy. He's given me permission to tell the story. He's had surgery with me about 8 or 9 years ago, and as I just heard from a cousin of his who operated on the mom and dad and another cousin, they're all doing terrific after their mini-gastric bypass now 8 and 9 years ago. And he came to see me disabled. He was a plumber and couldn't work because he had a massive abdominal hernia. And he weighed just under 500 pounds. And I told him I don't do patients that weight, and I turned him away and gave him some other doctors to talk with. And he and his mom and dad and family all came back to see me about 3 or 6 months later, and they said, we really want you to do the surgery. And I said, well, thank you for coming, but no, I can't do the surgery. I apologized and sent him on his way again. Told him to try the OptiFast diet to try and lose some weight, and finally, he and his mom realized the way to get me to do things. They flattered me. They said, oh, Dr. Rutledge, you're the best. Anyway, so I said, okay, I'll do your surgery. And we did his bypass, and he did just spectacularly, fortunately. We got around his hernia that was lower in the abdomen. His surgery was not complicated, and he was, at the time, at 465, the largest patient I'd ever done. He did well for about a year after that. We fixed his hernia at another time after he'd lost about 200 pounds, and I guess about 250 pounds. And then he called me one day. He said, I was out hunting, and my hernia broke open again. And I didn't realize that after you hunt and shoot the deer, you have to drag them back to the house. So he was pulling the deer back through the woods, and his hernia came back. So I said, okay, I don't do hernias, but he's the same thing, Dr. Rutledge, you're the only one. And okay. So anyways, I was in the hospital one day, and I heard this code. Now the codes in the hospitals are designed to say things in such a way so they don't scare you all, the public, right? So if they say, Bill Smith is dying on the second floor, you know, it's just not good for business. So they have a code in most hospitals for somebody in trouble. It's code blue because they've turned purple and not breathing, or code 100. And so they called the code, and they also mentioned my name and the 5th floor. And I happened to be on the 2nd floor at the time. And knowing the elevators in my hospital, I ran up to the 5th floor, not being in very good shape. I arrived in Ricky's room, and there was Ricky in the middle, surrounded by the code team, a woman with paddles ready to shock him, and on the EKG monitor was your pulse rate. Boop. Boop. And I went, Ricky, what's wrong? He goes, I don't know, Doc. They just measured my pulse, and then all these people started coming in my room. So I said, how do you feel? He said, I feel fine. I got this hernia I told you about. And so anyways, we postponed his surgery for the hernia repair and had a cardiac catheterization and stress test. And it turned out his heart was fine. And the cardiologist explained it to me in this way. He had a Mack truck engine that used to drive around in his Mack truck. And now it's been transplanted into a little Volkswagen. And so it doesn't have to turn over very often. His great big old Mack truck heart goes like this. And the blood spins around inside for 3 or 4 times until it has to beat again. Because you had a heart for a 500-pound person. So it's like, it has a cigarette, you know, watches TV. Oh, they need more blood. And then the blood just spins around. So you have an athletic heart. And that's one of the things that the surgery does. And we expect that bradycardia. And it can be so low, it just scares the pants off doctors when they see it.
Well, yeah,
So that's the story of Ricky Abernathy, and that's why you have that heart.